Thanks for listening to the Lunch and Learn with Dr. Berry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Berry.
And welcome to another episode of the Lunch with Dr. Berry, everybody. I'm your host, Dr. Berry PR, your favorite board-certified internist, founder of drberrypr.com and PR Medical Consulting, helping you empower yourself for better health with the #1 podcast for patient advocacy. This week, we bring you episode 105 with Dr. Jerisa Berry, and we get to talk a lot about National Infertility Month, Infertility Week, and most importantly, we get a personal story with Dr. Jerisa and gives you the start from the beginning with her path and her journey when discussing the topic of infertility. I want to read some of her bio because, again, I like to quantify why some of these guests are so amazing, why I'm excited to have them here for you guys today with the Lunch and Learn community. Dr. Jerisa Berry is one of the nation's acclaimed doctors. She's a board-certified emergency medicine physician. She is a nationally recognized author, speaker, consultant, and media personality. She is the co-owner of a medical clinic and concierge patient practice, Vital Care Medical Center, with her husband, Dr. Adam Berry. Dr. Jerisa is the founder of Secure Your Fertility, where she helps single ladies and career-minded women take control of their fertility. Because of experience in medicine, both are the best teachers for women seeking to optimize and work through various fertility options. Dr. Jerisa is a subject matter expert in ovarian preservation, assisted fertilization, surrogacy, and helping to decrease the pressures and stressors associated with the process. And, ladies and gentlemen, that's just, a smidget of this person's character. She's an amazing being, amazing colleague. I've had a chance to know her for about almost 3 years now. And, I've kind of watched her grow through the journey that she's going to tell you today. And again, like I said earlier, she's going to talk about her personal struggle with infertility and, what she did to navigate this journey, right? And I'm excited for you guys to hear today's episode. So let's sit back, get ready for another amazing episode here on the Lunch and Learn with Dr. Berry. This episode is brought to you by the Lunch and Learn community store, where we are living out the motto, empower yourself for better health. In the Lunch and Learn community store, you can get your favorite t-shirts, ebooks, as well as other related products by Dr. Berry. Head over to shop.drpsblog.com and get a chance to get 10% off your first purchase by using the coupon code EMPOWER10. Again, shop.drpsblog.com. Live out the motto, empower yourself for better health. All right, Lunch and Learn community. So you just heard another fabulous introduction for a guest that we here in, the Lunch and Learn community have had an interest to talk to and get on the show to really talk to you about a very important topic, especially depending on when you're listening to this Infertility Week, National Infertility Month. This is a person that not only did I, know of, but know as a personal friend. It's been a few years, so I wanted to kind of get her on and kind of talk about her story. So again, thank you, Dr. Jerisa, for coming on to the show today.
Thank you. Thank you, Dr. Berry, for having me.
So, Dr. Jerisa, you're definitely the superstar this episode. So, and with the month that it is, right? Obviously I read the bio. Bio does what the bio does, but can you tell someone who may just be listening, who is Dr. Jerisa, and why are you such an amazing person, and why we're about to come and listen to you talk?
Why am I such an amazing person? Oh man, thank you for that. I think that whenever you, of course, your listeners have just heard that I'm a physician. I'm an ER physician, and I also own, of course, 2 medical practices in South Florida. But, sometimes when you step outside of your occupation, and I guess that's why we're here now, is because of, what I went through with my journey. It was a difficult time, but I was able to kind of turn that around. And I turned it around to really help other women, other couples that could be experiencing infertility or having problems conceiving. And so when you go through something that really is supposed to get you down, but you turn it into something great, that's kind of what I guess is making me amazing, So thank you for that. And thank you for having me.
What's interesting, especially, and we'll obviously get into the kind of the nitty gritty when we talk about infertility. I think it's a lot of times. I know when I was naive and didn't really know about the subject, I always assumed this was this disease or this issue that happened to older people or people who pass their ways, right? But just doing just my itty bitty research and realizing that this was actually a lot more common than expected. Was this something that, before all of this kind of happened with your personal story that, you thought of, you had any personal experience with friends or family members of?
Dr. Berry, no, and you're right on. It is so common. Even myself, I'm amazed. The more and more I talk to even younger women, it is not a condition of, women over 40 anymore. For me, for us, me, myself, and my husband, we didn't really know at that time. This is going back now, maybe about 4 years now, since we started, and a lot has happened. Of course, there's a lot more awareness and a lot more women and, of course, famous women have come forward. And so it's more of, a lot more people are talking about it now. But when we were going through it at the time, it was still kind of a stigma, and so it wasn't anything that we were necessarily aware. But us being both doctors, we knew that we didn't want to keep trying. Of course, infertility, the definition of infertility is, if you've tried for 6 months, if you're over 35, then you really want to kind of get to the root of the issue and seek assistance with a specialist. And so that's what we did early on. We didn't wait. We knew kind of what we were working with the timeline. And so that alone, that knowledge that couples can have, that don't keep trying year after year, go seek professional help. And that's what we did. Even as physicians, kind of early on in our process, we really only gave it 6 months, and we were like, okay, what's going on? Why are we not? Why are we having problems? I always knew I had fibroids. That is something that I've known since, my 20s. But fibroids are not necessarily a problem. You can have small fibroids, and depending on where they are, the location, the size, you can still have, a viable pregnancy or not. And so that was kind of one of the issues that we had, where, we sought specialty services from a doctor.
And what's interesting, especially for the lunch learning community, I just want to kind of, we're going to, throw out some myths that we tend to hear all the time. And then just to give some raw numbers, right? Because lunch learning community likes to, they like the numbers. They like to kind of put stuff in perspective, right? So a lot of the myths that we really want to get out the way really early, especially in this show, when talking about this discussion is, that infertility is rare, right? That's a myth. That fertility issues are a women's problem. Which I think which is probably one of the biggest, travesties as far as the subject in general. And I definitely want to kind of get your opinion on that. How much onus is unfortunately put on the woman as being the issue.
Oh my goodness! Thank you, Dr. Berry.
Yeah, no, it was again. No, I trust me. I got you. I got you this episode. It's because I think your story is definitely one where it's going to resonate with a lot of people. And I think you hit it right on the head. I think now that like I'm in the know and I know of, and all of a sudden I start looking around and I got a lot more friends my age,
left and right?
And I'm like, oh, okay, oh, you too, and it's one of those things where right when it's hitting in your face like everywhere. It's always been there, right? And right. I think you hit it right in the head when you said like we're becoming more aware of it. And now that we become more aware, we know what the definition, we know what that term means. All of a sudden, we're starting to see it, and we're seeing the issues kind of hand in hand. Mm-hmm. It's some quick numbers. 1 in 8 couples, right? 1 in 8 couples have trouble, getting pregnant. 7.4 million have had to receive infertility services in their lifetime, right? That's about 12%. And just from a causes, right? Because again, I know we like the causes. 1/3 is attributed to the woman, 1/3 attributed to the male, and 1/3 is really a combination of issues that are really kind of, both partners are unexplained, right? So, these are myths and facts that I think really has to be kind of hit home for folks to really understand. Like, no, we're actually dealing with an issue that's really widespread, and it's widespread in our face, but we don't even realize it.
Yeah. Yeah. And I mean, you said it. And even to to add to that, 2 million couples each year, every year, will have difficulties conceiving. And yeah. And then the numbers in terms of the male component, or the male factor of infertility is increasing. The latest studies are really saying it could be close to 45% of, the causes. So
Wow.
we have some astounding numbers, and we're just glad, that we have this month, this week, where we can kind of talk about it more and create a safe place for even more people to come forward and really just shed light on it.
And I think that's what's so important, especially with these months, because every month seems to be some type of month where we're aware.
Right.
And I always get the question, well, why do we have to be aware of this issue, right? And it really is because a lot of times y'all kind of go silent, right?
Yeah.
And this isn't a thing that's only affecting a few people. This affect a lot of people. Millions every year are affected by infertility, but if you don't shed the light, if you don't, spotlight and say, hey, we're talking about it now, sometimes it can get lost in the shuffle of all of the other, medical issues that, may take a little bit precedence just from a media standpoint.
Mm-hmm. Exactly. And then, the more and more we talk about it, the more you have, companies that come forward and say they're going to pay for fertility treatments. Or you have, even this year, New York State came forward and said that they're going to cover IVF fertility treatments for their couples. So they're joining the ranks. Is really only like 4 or 5 right now. But, the more we let them know, look, 2 million couples are affected by this. What are you all going to do to really help us? Then you do have companies, these corporate companies, I won't name them, but, that are really coming forward, thankfully, and helping to pay for it, because it can be expensive.
We're definitely going to talk about the expenses for sure, because I think that's something that sometimes is prohibitive to a lot of people when they talk about options in that regards. So when we talk about infertility, and again, we know that we can no longer look at it as if you get over 40. Is there a certain age anymore that women really should start thinking about it? Like, is there what should women be thinking about? And again, I hate to say women because, as your stats show, 45% of men, which I got some theories on that. We'll kind of hash back why we may think 45% is being affected now. But is there even an age anymore that women should start thinking about it?
Ooh, Dr. Berry, it's a little scary. The more and more I, consult with women, the more they reach out to me, the more I even do, things with my, Secure Fertility, the masterclass. I meet younger and younger women. And, there really has not been a consensus, even with fertility testing, as it is with pap smears or mammograms, there really isn't an age that they've put so far. The American College of OB/GYN, obstetrician and gynecologists, they had talked about fertility testing, as, the pap smear, but they never really came to a consensus with that. But it's unfortunate because, society has made it as though, you should be concerned if you're over 35 or if you're over 40, but oh my gosh, Dr. Berry, I'm just amazed myself with the younger women, the women in their younger 20s, younger 30s that are having problems. And the problem, it varies. Of course, the causes of infertility are various. I met with a young lady about a month ago now. Her egg reserve is low and she's 34 years old. She's single and she's never been on birth control. She's been single for some time and she decided to get her test through our app, and she found out her egg reserve is low at 34. But, of course, she's not 40, and then I've talked with several women who have been in their 20s. And so there isn't an age, but, forums like yours, forums like what we're doing with, National Infertility Awareness Week, hopefully lets women, even younger women, know, it's something to not just put on the back burner. If you you're single, that's kind of my cause. If you're single and waiting, don't hesitate to kind of see where you stand with your biological clock. But unfortunately, they haven't put an age on it because it just varied, and
And it's interesting, especially because if could you kind of elaborate? And when you talk about like egg reserves and biological clock, is that like the same thing? Like is again because that's a new term again, lunch learning community. I use these guests to like learn as well. So like there's definitely a new term for me, egg reserve. Like that's like how would a person know if their egg reserves are even low?
So yeah, well, that is the biological clock. It's a common, joke that, a lot of women say, our eggs are drying up as we get older, or, of course, our biological clock is ticking. But, when you look at it in terms of science or medicine, when you see a fertility specialist, they're going to look at your egg reserve or your ovarian reserve. And that's what we also realized when we were going through the testing and we talked to other couples, because you meet a lot of couples, when you're going through the process, especially women, we're stressed. So of course you're going to talk to someone else and kind of see what they're going through. And so we met and we talked with a lot of different couples while we were going through the process. And even our specialists, we talked about fertility testing. Why isn't us being physicians, of course, why isn't it available for, couples or women that are younger? Because of course, their biological clock is ticking. But women are born with a finite number of eggs. Men, they can always grow new sperm. But women, we're born with a finite given number of eggs. And that varies from person to person. It varies from mom to daughter to grandmother, And so there is a test that is available. And of course, nothing is in medicine is exact. But yeah, there is a test that is available that can give you an idea of the number of eggs, okay, which is the reserve, your egg reserve that you may have left. It doesn't really talk about the quality, but that particular test called the AMH, or the anti-Müllerian hormone, it has gained a lot of popularity recently. A lot more, studies have been ongoing with it. And it can let women know, if it's low, that your egg reserve is also low. And that knowledge, whether you're, 35 or 25, can really guide you. It can guide you with your family planning, even when you're single. Because if you think about things like, should you freeze your eggs, when you're single? And so those are kind of the conversations that I'm having with women, even in their, younger 30s, as it relates to the biological clock or the egg reserve.
And when, especially because you're as being in the thick of things and being, as a kind of like a world leader now, when we talk about infertility, what are some of the reasons that you're running into, right? That people say, well, I'm infertile because of this, right? And again, like, I hate that we're biasing just the women, right? Because men got a lot more issues in and of itself. But like on the women's side, like, what are some of the reasons? And we talked about some of the myths like birth control and things like that people used to say, oh, if you hit birth control once, all of a sudden that's the reason why.
Right. Yeah, that is definitely a myth as it relates to birth control while you're on it. So the causes are vast. As being a physician, of course, you have, fibroids, which I talk a lot about. Fibroids can affect, 20 to 80% of women by the time they're age 50. You have endometriosis, of course. 1 in 10 women will be affected with endometriosis. Same thing with PCOS, or polycystic ovarian disease. 5 million women in the United States alone has been diagnosed with PCOS. And then one of the more common causes lately, studies are showing, is the the blocked tubes, or the blocked fallopian tubes, or tubal occlusion is about 40%. About 40% of cases now of infertility is the blocked fallopian tubes, which, that can be from various things. That can be from scar tissue, that can be from STDs, that can be from, hydrocele pinks of any cause. So it's just important for women, especially couples, that if you're trying and you have really been trying, you're under 35, don't give it longer than a year before you really seek to see if one of these reasons could be the cause, and, perhaps seek treatment for that, or, fertility assistance.
And kind of leading up to it, especially when we talk about, some of the treatment options, because it definitely sounds like there's a lot of anatomical reasons, right? Especially for the women's side. I've, and again, lunch learning community, if you don't know, for some reason, I'm an internist, right? So one of the reasons why I did internist is so I could avoid women's health. I'll be honest. When I was in medical school, they used to kick me out the rooms. So I said, you know what, I'm going to do internal medicine, and I'm going to go away from women's health. So every chance I get to educate myself on women's health, I do.
Mm-hmm.
So from the male side, every time, when, I'd have patients come and, talk about infertility, the thing I would do is, do a sperm count, right? Like that was from my standpoint, like, all right, let me do a sperm count on you guys, because that I think that's what I'm good for. Everything else, I'm going to send you to somebody else. Now, is it just that simple, right? Especially on the men's side, like, oh, let me just do a sperm count. If your sperm is low, that's it, and boom, bam, boom.
No, it's not just a sperm count. When it comes to the semen analysis, they check for the, of course, like the count, but they also check motility as well as morphology. So you want to make sure that, the DNA quality is good, not necessarily just the count. Yeah, you can have a low sperm count, or you can have a normal sperm count, but you could have, still problems with them not moving as fast, or the motility, or the morphology. But the good thing as it relates to men is that when that, there's a lot of even, so one of the things I'm big about is getting a second opinion, and also holistic medicine. And so when we met with a fertility specialist as well, and my husband, we both had things we wanted to change, and they have male supplements that you can take to improve your morphology. And so when you meet with a good holistic doctor or fertility specialist, be open to that, because the men, their semen analysis, they can improve. Women, as it relates to egg reserve, that's, you can't really change that. You can do things to improve the quality of your eggs. But, for men, it's good to know if they could be, the factor, because there are certain things that they can do to really improve their chances, and really try again, 3 months after you've kind of, tried certain things to improve your semen analysis.
And kind of leading into it, when we talk about the patient who comes in, or the client who comes to see you, and they say, Dr. Jerisa, I'm infertile, right? What are some options that are out there? So
that's where you really want to see why. I've met, oh my God, it's a vast number of reasons. Most recently, I'm so happy about this as well. I had a young lady where she had a polyp. So she didn't really know. Her and her husband, they tried for 6-7 years, Dr. Berry. Like they tried forever.
Wow, 6-7.
Sought assistance. And so she, got one test. She had one particular ultrasound, and I was able to look at that and point something out to her, because there was a filling, defect that was seen, and I recommended her to have another ultrasound. And she did. And so what they found was that she had a polyp. And, you don't necessarily have to have fibroids. You can have cervical polyps. You can have polyps that can affect implantation. And so you want to know that, right? Because you can remove that. You can have that surgically removed, and then that can increase your chances of, having a viable pregnancy. And so, when I meet with women, there's various causes of, infertility, blocked tubes. I've met with, several women where that was a cause. And so, the treatment for that, for a lot of women that don't necessarily want to have surgery, because the prognosis of, surgery with blocked tubes is not necessarily the best. And so a lot of times, at the onset, doctors are recommending IVF, but, IVF can be expensive, but, it can be a viable solution, and so we're, of course, we're happy when more and more states are paying for it, because for something like, tubal occlusion, that IVF is going to really help that couple, then, it's good to have that as an option that they can afford.
And I'm definitely glad that insurance companies are kind of getting, on the ball, like, especially when it comes to like paying for it, because it's one of the more frustrating things, especially in medicine, that a lot of times we'll have options that some bureaucrats are like, no, we're not going to cover your medical problem. 'Cause I'm not sure if it's just a lack of recognition or what it is, but unfortunately, that tends to happen in medicine where they catch up late
a lot
in that regards. Now, as far as in your story, right? When we talk about the treatment option that you were able to undergo, and when we talk about the IVF, right? Like what was there any hesitations, right, when you went in that direction? Was there concerns? Like what was the thought process?
For us, doctors are the worst patients, so
Trust me, I know.
So we knew any and everything about it. We probably were, I think we were good, but we probably were difficult a little bit, but we wanted to know everything, but we were open to it because, we knew that kind of was what we were working with. You know what I mean? So I don't know if, your listeners know my story, but I had, surgery for my fibroids. And when you're going through things like IVF, or I went through IUI as well, the fibroids can grow larger because of the medication, the stimulation that you're doing. And so that's actually what happened. We had one ultrasound and then we had another ultrasound and the fibroids were larger and come back. And I'm like, oh my God, so, for us, it got to a point where it was like, what, I've already had surgery. We've done all we can do right now. We have, 2 embryos right now. So, the risk versus the benefit. And it's tough because, you have a lot of questions that, you sit down with your significant other and you try to come up with the answers, or at least the process that you're going to go through. And it's tough making some of those decisions, but for us, kind of weighing the options, it's like, well, we know that if I have surgery again, we're going to have to wait another 6 months. And then there's still no guarantee, that I already had one miscarriage. So, we it's not like we have 10, 20 embryos. So you want to, for us, we wanted to create or have the best viable option for the growth of our baby and, for a long full-term pregnancy. And, it got to the point where it wasn't going to necessarily be with me. And so, those are the decisions that, couples have to face. How many IVFs do they want to do? Or, we've heard of celebrities, right? That went through, 7, 9, 10 IVFs. Angela Bassett, Gabrielle Union. I'm like, oh my God, I went through like 3. Lord, you went through how many?
Right.
But those are the tough questions that you don't necessarily prepare yourself for. But when you're kind of faced with it, you just have to, just do all this you have to do to get through it. But it is, it is tough.
And when the decision was made, I said, you know what, I've done all that I can, right? I've taken the steps, I've done the nutrition, I've done those things, and my body isn't like the body that's going to be it, right? What was that thought process like, especially when you're thinking like, all right, I think I'm going to need someone else, right, to help me out here? Because especially as a physician, but just people in general, a lot of times when we're dealing with problems, we tend to always think we're the only ones. But it sounds like pretty early you were kind of, and I'm not sure if this happened after the fact or while you were in it, you got within a community of women and men kind of going through the same issue that you are going through.
Mm-hmm. Yeah, I think for us, we realize, and even, my husband will say that, it is just so much more common. And, this was before Michelle Obama, but Gabrielle Union, like this is before all the, big, celebrities came forward.
Mm-hmm.
And I guess we just got comfortable with it. We are a praying family. And, I always pray for direction. I pray for God to protect me. And, we know even last week, the number of Black women and, postpartum or peripartum mortality, and so could this have been something that protected me? I really believe that. But, I just think that, we just got to a space where it was like, you know what, we have done all that we could do. And we prayed and we looked for open doors and, we listened and I have my mom and my husband, we just did a lot of praying and meditating, and I guess I just got to a place where actually, and I didn't mention this, I've talked about it a lot, but even before surrogacy, that route, I got to a place where I was like, well, maybe I'm okay, to not be a mom. You kind of go through that phase as well. It's a lot of phases you go through, but
I bet.
You go through the acceptance phase. And I think that's kind of what helped us kind of get more comfortable with the surrogacy, because I could still be a mom, whereas, before it was like, okay, we're dealing with a miscarriage, or, we're dealing with the fact that we may not be parents, but now, oh, wait a minute, we do have this option of, gestational surrogacy. And so, you're just thankful for the options and, being open to that. There's some couples that are saying, nope, I don't want to adopt. I don't want to do, but, for us, we were open to, various stages, including adoption. We were open to that as well, if it got to that point.
Sure.
Yeah.
And with the surrogacy, is that something like there are national companies that do it? Was this within the support groups that you were able to reach out with, other like-minded people who of the know? Because I feel like it's, and I may be wrong, is this something that you can just Google? Like how does one even find the surrogate and screen the surrogate and do and all of these things that I feel would have to occur before you say, yeah, you could be my surrogate?
Yeah. There is a process. There are several agencies, and so there's a lot of, I guess it's more widely known or talked about in terms of adoption. And so, a lot of people know there's adoption agencies that, you want to use. And so it's the same thing with surrogacy. They have surrogacy agencies all across the country, and more daily. So be careful which one you go to and how you choose that. Make sure you do your research. But we chose to find a local one. You don't have to use one within your state. You could live in Florida and have an agency in Utah. But we chose to kind of go with the recommendation of our fertility clinic, as well as have a local surrogacy agency. But yeah, you can. Of course, it's always good. Also, you never know. You might have a family member, a friend, a church, anyone that, may be near and dear to you that may be willing to, carry for you. But for us, we didn't have that. And so we went through the guidance of a surrogacy agency, which I highly recommend that you don't do it without consulting an agent.
An agent, perfect. And was there any process as far as, because I know we talked a little bit about from the holistic standpoint, because I'm always interested, and a lot of my Lunch and Learn community members are always interested. Sometimes I feel like maybe too interested in the holistic point of view, where there's certain minerals and vitamins, things they can take that can kind of help prepare them, especially for surrogacy or IVF or infertility. Was there any tips or tricks that you got along the way on that route, especially from the holistics? Because again, I got some Lunch and Learn community members. They're strict on taking their vitamins and minerals, but I can't get them to take their blood pressure medication. Yes, I'm talking to some of y'all.
Yes. Try everything but the prescription medication. There are several things that have been kind of widely talked about in the fertility or TTC, trying to conceive community. And that varies from, DHEA to, CoQ10. And one of the things also that is big is acupuncture. Acupuncture acupuncture is good for several reasons. Now there are some acupuncturists that specialize in fertility. And those are the ones that you want to, seek after if you're fortunate enough to have them in your community. We actually do have some here, but it increases the, blood flow. to your pelvic areas, your pelvic organs, and it also helps to reduce stress overall. But, there's a lot of research that's been done to support the benefit of not just some of the supplements that I named, but also acupuncture. And for us, nutrition is big. Nutrition, we realize, for me, I lost 15 pounds. I did change a lot of what I was eating just to kind of eat healthier. But yeah, holistic medicine can definitely help.
Okay, all right. So my holistic listeners, you got your section. And because I already know they was going to ask me for it. I already know if I would have went through this episode and then asked about what about the whole, they would have.
I
got a DM. I got a message. So I already knew. So there you go. So I think first of all, congratulations, right? Congratulations on going through the downs. Which and you said it's the try to conceive community. I actually caught that. It was the TTC community. Try to. Okay, all right. Again, Lunch Learn community. We're here to learn, right? And Dr. Berry's learning just as well. Thank you for kind of sharing the story, right, of your lows and congratulations on your high, right? Like how old is the child now? How old is your child?
He is 8.5 months. He is such a joy, worth every tear, penny, dime, bill, everything. He is a joy.
I love it. So because of course, I got to highlight, right? And I want to talk about secure your fertility. And most importantly, I want to talk about the motivation behind it. Was this something that you thought of, in the middle of going through your journey at the end, like when you realize, and I find it sometimes when we're going through, because my oldest child, she's autistic. And when my wife was going through the troubles of getting services and realizing like so much of a void that was there, that's when a light bulb kind of hit her and said, oh, I need to do something for like that. Was that like something that kind of driven you when we talk about security fertility, or was it something that kind of naturally happened? Did you always kind of think about it? What were some of the, walk us through, right? And then let's brag and let's talk about security fertility and all of its glory.
It wasn't anything that I thought about prior to, having my own issue, and our own difficulty. I was blessed to connect with a wonderful doctor by the name of Dr. Dre Birch. And in his class, he kind of coaches physicians that, may want to do things outside of medicine, and, just coming up with your passion. And he kind of taught us to kind of turn something that might be, a difficult time into our passion, And so having gone through his class where, like I said, he coaches different physicians, that helped me realize, because I was kind of going through that at that time, that, maybe this particular dark moment that I'm having could help someone else. And so it just happened that, because my husband, we own a primary care clinic. We have a relationship with, a lab, a national lab. And so we were able to kind of create that account. And we just said, kind of going through the process, like I said, we learned a lot. We talked to so many different specialists, so many different other couples, that we wanted to make fertility testing available before you even have an issue. We said, you know what, because we knew insurances are not covering it. We knew that there's single women that are not necessarily thinking about it because they're not trying. And so we were just like, together, my husband and I, why, maybe we should kind of use this to increase access for, those single women to be able to get fertility testing. And then that just kind of opened the doors for secure fertility, which is kind of taking a meaning of itself, and just really inspired a lot of people, like you said, worldwide. We had, over 4,000 downloads within 6 months of our first launch. And now we have joined forces with, different celebrities, and just kind of wanting to get their story out, because a lot of us, we know when we hear someone like a celebrity that's going through an issue, it also just increases awareness and brings more attention to the cause. And so we're just excited, for secure fertility, the fact that it's helped a lot of people so far.
And what I love about secure fertility, and we talk about this a lot in the lunchroom community, where prevention. We don't want to be blindsided by information that we could have gotten earlier. It's the reason why we say go get your annual checkup, right? It's not because we expect something to find out. We want to stop you before you get the diabetes, stop you before you get the high cholesterol, the high blood pressure. So when you have an app like Secure Fertility say like, hey, like, I'm not even saying that you're looking to have children right now, but don't you want to know that when you are ready, right, it's good to go, right? Because it's easier to say like, all right, good. And you do secure fertility, everything is great. That's good to know. That peace of mind is good to know. But not knowing is, and Jerisa, you could probably piggyback on it, can sometimes be dangerous, right? Because again, and I think me and you, we run around the same circle of women, especially career-minded women who aren't really thinking about having a child right now, thinking about having it later, but not realizing the time that I don't want to say losing, but they're kind of losing because they're not just aware of what's going on.
You're not. You're thinking that, when you turn 37, 38 or whatever, that it's going to be fine when you meet your husband. But when I can honestly say that when we, first launched Secure Fertility, I didn't necessarily know about the impact that it would have or the women that I would have met that have the causes of infertility that they do and at their age. I've just been taken aback. Like I said, a 34-year-old, and even, 28-year-old. That's kind of when I first started about this. I met with a 28-year-old who at that time had a low egg reserve at 28, Wow. And so the benefit of secure fertility is just hands on. I'm very happy because the young lady that I consulted with last month now knows, she now knows about her low ovarian or egg reserve. And in that conversation, we were able to kind of guide each other, guide her more so into what she should do next. And in her case, I'm like, you got to really think about freezing your eggs right now. She didn't think about that before, you kind of just going through life and building your career and, but the fact that she ordered that test, she now knows, and she was able to check her insurance and, see what they would cover, what they wouldn't cover, and just kind of take steps towards, freezing her eggs.
Like let's take us to the process of someone who downloads the app. Now the app is available where?
Everywhere, Google and Apple.
All right, perfect. So if for some reason your team Android, the app is also over there as well. But if your team Apple, like over here, you go to the App Store and you download this app. Like, what is the process? Like, what take us through, right? Especially because it sounds like they eventually get to talk to you, right? So, like, what happens? What are some of the steps that lead up to someone saying, like, all right, let me go get this consultation in. Let Dr. Jerisa school me and educate me.
Well, through the app, there's several things in the app. We don't just have fertility testing, but when you download the app, you are able to see, and you scroll through, and one of the features is fertility testing. Of course, we have other features. We have the financial component now, which I'm happy about. All the financial resources all in one place. Of course, we have celebrity fertility, but fertility testing, you can just click there and you enter your information. Of course, you order the test. Once you order the test, you then will get an email. Usually the email comes within about 2 to 3 days. Okay. You get an email with the instruction, and that instruction lets you know what laboratory you will go to. You then go to the laboratory, you give your blood, but the testing starts at home. We take care of the doctor's order, you pay for it, insurances won't cover it. And so that's kind of the issue with, the society right now is that insurance is not going to cover a $400 test. So it's not $400, for us, it's $107. So we lowered the cost as well. And we just kind of made it direct to order fertility testing. Once you supply the blood, you then can log in, you register with the site, you log in, and usually within about 5 to 7 days, you can log in and get the result right there from the comfort of your home.
And once they get this result, because again, I'm actually very excited. Like again, lunch learning community. I hope you hear that. Like this, not only do they skip the middleman, right? They give it to you at such a discounted rate. So even if you wanted to do this on your own, you'd see the financial investment you'd have to make if you don't go through this app. And again, I encourage all my listeners. If you have friends, if you have family members who you realize like, oh, they've been here for a while, and are they trying? Are they having problems? Please make sure you recommend this app. Again, the link will be in the show notes. You can do it from the comfort of your own home. It's a much discounted rate. So there's, and we're not even going to tell you about the celebrities because we want you to download the app to see the celebrities, right? Okay, so they get these results. And do they get an explanation of the results, and who do you got? Like, how does that?
Yeah. So what we typically do is any abnormal value, we do notify them. So if it's considered abnormal, then we have a process in place that we notify them. They, of course, when they order this online, they are consenting to getting information online. Okay, so that's kind of our privacy policy. But we notify them also that your result was abnormal. Would you like to consider having a consultation to discuss your result? If your result is normal, then it's normal. But any value that's considered abnormal, we have a process in place. So that way of course, we're covered, but we also want to make sure that they, feel comfortable with that and that they checked. Because, believe it or not, I've actually had women order and they go get the test, or they order and they don't log in. Yes. I was like, oh my gosh, you still haven't gotten the test yet and you ordered. So, we just kind of follow up with kind of a closed loop procedure.
Sure, that reminds me of some of my patients. They'll they come to the appointment, they get the prescription, they get the lab set, and then you just be waiting, and you're like, hold on, did you go get the lab work?
Yeah.
Oh,
yes. Yeah, so there's we try to have a closed loop system, especially if the value is abnormal. Yes.
Perfect. And do you personally have to like talk to everyone, like especially because I wonder about you as a fellow mogul. I always worry about my fellow mogul's time. Like, do you have the time to talk to 4,400 people? Like, is that?
No. I have staff. I have a team, and okay, I'm blessed to have the team that I have with me that have been with me since the beginning. May of 2017 when we first launched. I've kind of had the same people around me that are involved in the processing of everything.
Love it. And so tell us what's the ultimate goal, right? What's the ultimate goal for secure your fertility, and where do you see yourself, right? Especially as being a leader in this industry, being a person that, not only like a figurehead, but someone we can kind of look up to and see the personal story and be happy, right? Be happy for your triumph as if it's our triumph as well. Like where does Dr. Jerisa go in 3 years, in 5 years, in 10 years? Where does secure your fertility go in 3 years, 5 years, and 10 years?
Well, secure fertility will still be there. It will still be an avenue for, women, couples to get their fertility testing before it is a problem. So that will still stand. I'm happy, like I mentioned, in terms of, the relationships that I've formed and, developed, and excited about celebrity fertility. Celebrity fertility was something that came about because, a lot of us, when we hear about Michelle Obama, or we hear about Gabrielle Union, we want more of their details too, and how they got through it, because it's oftentimes, they're up, you think they're so perfect, or they don't go through trials and things like the average person. And so I'm happy to kind of bring their stories to light. And, hopefully that will continue to just kind of inspire everyone that, even as celebrities go through it and they, are able to be successful and go through their trying times, and that can just give hopefully anyone the same kind of hope. So I'm just excited about that. And, what the future really holds, I don't necessarily know, but I'm open to wherever it it leads us, Dr. Berry.
I love it. And what's the most important, especially because I think the with the celebrity fertility will add, right? Because I think a lot of times, I think you said, because again, we're talking about awareness, right? And of course, we're in the month of April, and of course, they're aware here. But when you hear a celebrity, right, talk about infertility, right, all of a sudden you start thinking like, okay, all right, their money couldn't protect them from a problem, right? Their fame couldn't protect them from a problem. You know what? They are kind of just like me, right?
Yep.
And once you get that, right? Once patients feel that, that's when all of a sudden they're more open, right? That's where they don't wait 6-7 years, right? Because I can tell you what happened, right? After that second year, they probably wanted to talk to somebody, but because that barrier. And it's usually a mental barrier. Sometimes it's a physical barrier, right? Because that barrier is there, they don't even want to reach out for the help because they just keep trying and trying and trying. Because they're like, no, this got to be something different, right? But now when you have security fertility, you have the celebrity fertility, you have all these different avenues to say like, oh, you know what? I'm not alone. Right.
Yep.
And once they realize I'm not alone, then they're open. Then they join the TTC. As you can see, TTC community.
Yeah.
they do that, and that's where the story comes. So again, I always brag, right? I brag on all my medical moguls, right? Especially you, because we were there, right? We were there again, lunch learning community. Where me and Dr. Jerisa probably rocking since 2016, I think. Yeah, 2016. So, the journey I've been following along since the beginning as well too, and I'm just like amazed and ecstatic when I see her do just these amazing things that we knew was in her, and once she realized it was in her, like the sky was the limit.
Oh, thank you. Thank you. Thank you so much for that. It's you have to kind of rely on, well, at least, for me, I've relied on my faith a lot and, relied on the prayer. And, for some couples, and it's sometimes it's a hard conversation to have with, certain women that are, on their 10th, 11th IVF. But, I really encourage women to really just kind of start to be happy with who you are and where you are now, even before, the baby and without the baby. You really want to love yourself, whether you're going to be that mom or not. And you have to kind of get comfortable with that and really be genuinely happy with who you are and seeking your purpose. Whether you are successful or not, it's tough to have that conversation, right? We diagnose people with cancer and all kinds of things. And so it's I'm not being a pessimist at all, but I really want to encourage women that are having difficulties. You're still trying, you're still not successful, to find that peace where you will be happy with who you are as a person. You may not become a mom. Maybe that is not necessarily in your story, but your story is still whole. You are still a beautiful person and you still have a purpose. And so that's what helped me. That's the realization that I came to. And maybe that took me to, a high. When you sometimes when you stand still and you turn it over and you just accept where you are, sometimes things happen. But, ultimately be happy with who you are and learn that purpose no matter what when you're going through your fertility journey.
I love it. And before you go, I always ask this question to our guests. And you've actually already answered it, but we'll ask it again. Like, how can what you do help empower families really to take better control of their fertility?
Don't wait. Those stories where, couples wait, 2-3 years, that needs to be of the past. If you are, of course, if you're over 35, only give it 6 months. If you're under 35, give it a year of trying before you seek special, to seek a REI, or reproductive endocrinology specialist. And also for those single women, that are not necessarily trying, that, you're building your career. You may not have met your knight in shining armor. there is a way. There is a way where you can kind of gain a sense of where you are on the biological clock through secure fertility, and it can help you with family planning before it becomes an issue.
Love it. Love it. And before we get you out of here, where can others find you to get in contact with you, to get some paid consultations with you, to have you speak at their conference? Where can others find you?
So we have, of course, www.securefertility.com. Of course, www.drjerisa, that's JERISA.com. And you can also email me at drjerisa@gmail.com or info@secureyourfertility.com. Of course, I'm on Facebook and Twitter, Instagram with Dr. Jerisa.
Love it. And I remember Lunchline Community, depending where you're at, listening, at work, driving, shower, whatever. All of these links will be in the show notes. So you'll have access. Again, even for some reason, if you're on Team Android, I'm going to make sure the link to the Android app is there. If you're Team Apple like myself, the Apple app will be there. And I was just thinking as we're talking, right? And again, I hate I'm definitely about to get y'all. But as I was thinking, like, what an ultimate goal for me, especially for secure fertility, right, is that when I'm doing a primary care visit, and especially if it's and especially right now if it's a woman, right, like I would recommend, like, oh, hey, you know what, this is an app for your fertility, right? Like that's like, it just hit me, like, as we're speaking, like that's it, right? Where people realize, like, oh, yes, let me get my A1C and my cholesterol. Oh, let me get Secure Your Fertility app checked on, so make sure my fertility is looking good, right? I just put it out there. I'm putting it out there to the world. I'm gonna let Dr. Jerisa go to work and do it. I'm gonna give her the hard work, but I'm gonna just put it out there to the world because that's where I think it should go.
Yes, it is. Absolutely.
Dr. Jerisa, again, thank you for coming on the Lunchline Community. You've been absolutely amazing. Your story is absolutely uplifting, empowering. And, again, we're here when we empower ourselves for better health, right? You have done that. And not only have you done that for yourself, but you're doing that for countless of others. Again, thank you.
Thank you, Dr. Berry.
Thank you for getting to the end of the show. I am your host, Dr. Berry Pierre, host of the Lunchline with Dr. Berry, and this is another amazing episode that we like to bring to you week after week on betterment of empowering yourself for better health today. If you have not had a chance, please go ahead and subscribe to the show. If this is your first time listening, if you already listen and you've already subscribed, make sure to leave me a 5-star review because your support is absolutely important in keeping the show moving as it is. And if you have not had a chance and you want to check out today's show notes, always head over to lunchlearnpod.com. That is lunchlearnpod, all in one word.com, and you can get the access to my show notes for every single episode, but especially the one you just listened to. And I'm going to see you guys next week. You guys be blessed. Bye.